and bend that small finger.
If you block it. You gotta block it.
Okay, relax. Bend the tip. Bend there. Maybe. We'll see. When we saw Carlens, he was about a week and a half out from the accident in Haiti, and he'd been cared for locally by a team from Savannah, Georgia, and they had thankfully washed out the wound and partially closed it. So when he presented to us, he had a wound that was closed, but certainly was a significant wound over the essentially the palm around the ring finger and the small finger. So, you know, overall a significant injury. Thankfully, all of the fingers were being perfused, meaning they were getting plenty of blood supply, and were not in jeopardy of not surviving. But certainly, you know, he needed surgery to prevent infection and give him the best possible chance at having an optimally functional hand. And the recovery we expect is that he would at least get what we call protective sensation, meaning, you know, he could sense sharp, he could sense really hot, cold. It's not necessarily going to be normal sensation, but it would at least give him protective sensation, that he wouldn't burn the fingers and he could at least feel some things with those tips. Post-surgery is perhaps the most difficult time, because when you have a combined injury like this, you sort of have competing aims in terms of the therapy. So on one end, we want to keep everything still from the standpoint of the fracture, but from the standpoint of the flexor tendon repair, we want to get him moving. So you clearly can't do both, so you kind of shoot for a middle ground. So, you know, we had this joint back here pinned, and as much as possible, we'd had him trying to move through the joints downstream from that. And he has some motion, unfortunately. You know, things as you might imagine are a little scarred in. So, you know, he's working hard with Kathy Ormsby, one of our really good hand therapists, and we'll see how things go. But, you know, it's a long-term process with an injury like this.
And pull. So even though this finger did not, the ring finger did not have a tendon injury, it's still having some scar tissue issues that make it difficult for that tendon to glide as well. Let's hold it up. This whole area is scarred, right, all the way down there, and it kind of goes around the side of his hand, and then on the back, the scar tissue. And where they did the surgery, that process itself creates more scar tissue. Right. And scar tissue is important in that it heals those structures back together, but it's kind of a problem in that it sticks to everything it's not supposed to. It makes it difficult for all those different structures to glide and slide. Okay. And relax.
If we had fixed everything and then he sort of got sent along his way, it would have been extremely stiff, and he probably would have had very little function of those fingers. So, you know, certainly I don't expect that he's going to have a completely normal hand, but I think he'll be much further along towards that goal, having been able to work with therapists here, than he would have been returning to Haiti, where understandably they have bigger things to worry about right now.